Hi, I'm April from Ogden Clinic. We're here today with Candace Belik, who is a family medicine provider at our South Ogden Family Medicine location. And this location is one of 8 of our urgent care clinics that are still performing COVID-19 screenings. And we have some safety protocols in place. And so Candace, can you walk us through what's different now?
Oh, a lot is different here in the clinics. We have increased screening. You'll notice that when you come in the front door, there's a sign on the front that says, if you have any symptoms that are related to the coronavirus that, like shortness of breath, fever, cough, sore throat, that you are actually asked to stay outside the building and in your car. And a lot of the clinics have something like this in place, whether it's a separate entrance for those who have symptoms or a separate structure behind or near the building where we can perform, screenings and testing and treatment for, contagious symptoms. And then also perform the testing. So we're actually using a lot of safety measures in all of the clinics. If you don't have any symptoms, right, and you're wondering, can I come to my normal visit? We have screeners at every door who check temperatures and ask about symptoms. And if you have any symptoms at all, or you have a fever and didn't know it, then we can actually help know, if you need to go and be screened or tested or anything like that. Once you come in, you'll notice every employee and every visitor is wearing a mask. People are getting phone calls beforehand that are saying, make sure you wear a mask. Yeah, so we're spreading that word. And that's in order to keep our patients safe.
Yeah, I noticed that as I was walking in. I got my
temperature
checked. I had my mask on, and so that's great. And I like what you said about this clinic is still seeing patients for routine visits for family medicine care, and then also performing those COVID screenings.
Absolutely.
And so as far as the screening, where are we at? Are we seeing an influx, staying steady, or are they kind of on decline?
Yeah, so as of, now, this week, it seems as though the numbers are increasing in a measured way. People talk about that curve being sort of flattened. We've actually done a really good job.
That's good. Great to hear.
Yeah, so in answer to your question, are we seeing more of these cases in our clinic? I would actually say that over the past couple of weeks, we've seen fewer cases coming here to the clinic, which is good.
That is good.
There are so many community resources for drive-up testing and, ways to just, if you have mild symptoms and you just want to be tested, you can actually get that done without ever having to come inside. And that is huge for the community.
And if patients are high risk or they're still not so sure that they want to come into the clinic, we also have telemedicine available. Yes. Talk to us more about how you're using telemedicine.
Telemedicine has been a phenomenal resource for us as a clinic in order to keep our high-risk populations, people with chronic illnesses or people, over a certain age, we're able to keep them from needing to come into the clinic if necessary. We've been able to do webcam visits where we basically can talk to the patient for various things like mental health, med checks, even cough and cold type visits can be done over telehealth. And we can kind of get a good idea of what's going on. We can check out a rash. We can do a lot of things over telehealth, surprisingly. If there's ever a need to be seen in clinic, at that point we can advise. I think the cool thing about family medicine and about the changes we've experienced so far is we're actually able to be kind of the gatekeepers of making sure people are safe. If we feel that somebody needs to be elevated to a higher level of care, we can help them do that, and we can help them do it safely in a way that they feel, comfortable with, and they're getting the access they need. So in conclusion, just know that we're here. Life doesn't stop happening just because the world's become pretty crazy. We've got screenings for the coronavirus. We've got increased safety measures to keep people safe, including our staff and the members of the community that are wondering about care. And if in doubt, call ahead. Make sure to call, check in with your provider if you need anything, and we're here.
So for any questions or to schedule your next visit, visit us at ogdenclinic.com.